Hey, I'm Gabriel. I'm one of the massage therapists here at Pivot Sport Medicine. Today, I'll be showing a few intro techniques that you can expect when you come in for a massage. These are techniques that I'll do on people that have a really sore back or they come in and they work a lot of hours at the office. So it's something I'd like to show today. So the first technique I'm going to be using is broad compressions. I always like to start off in between the shoulder blades right here. What I'm doing is using a really, really broad pressure using the palms of my hands. And I'm going at the slow pace here, working slowly into the lumbar spine, feeling for any tightness in the muscles, but I'm also feeling to see how the bones underneath are moving. Sometimes if I feel something tight, I'll kind of go over it again. Once I get over here to the iliac crest, I usually move one hand over into the sacrum, give a little bit of traction to the sacrum, and then work my way back. And again, I'll show kind of, once I get over here, I'm kind of gliding, seeing how well the fascia glides, and then seeing how the muscles feel with a little bit deeper pressure, seeing how the ribs and the spine is moving. From here, I'll work my way back up. I'm checking on my patient, seeing how they're breathing, staying in between the shoulder blades here, and then lowering my body with my movement here until I get onto the tops of the shoulders. From here, I'll work out until I get to the AC joint, which is that bony part over there, and then work my way back in. Some things you want to look out for when you're doing this technique. You want to look out and make sure that you're never over the spine, this bony part over here. And you want to make sure that you're not using too much pressure to disrupt the breathing of your patient. Once I get over here, I'll start to change my technique, and I'll show you that next. So this next technique is the effleurage technique. This is a technique that requires some lotion. So I'm just using that now. And I'm warming up this lotion before I put it on so that it doesn't feel jarring because it might be a little bit cold. Again, I'm starting in between the shoulder blades here, getting my body set and going all the way down to the hip bones here and then back up. So these first couple movements are just to be spreading the lotion onto your patient. And I'm using the same landmarks that I did last time with my broad compressions. So I'm working all the way down to the hip bones here, kind of keeping my hands, if you can see, a little bit open here, just so that I avoid the spinous process, which is that bony part right there. And it goes all the way up the spine. So I'm working way back, feeling for the big muscles on the back here. In between the shoulder blades, here's where my hands will start to come in. And then once I get to the top of the shoulder blades, spread my hands out and then work back in. And with this technique here, it's an intro technique. So I'm kind of using it to feel, where do the muscles feel tight? Are they different in the low back versus the thoracic spine where I am now versus the neck when I get up here? And with this technique, I'm trying to add a little bit of pressure with each stroke. Again, checking in to see how my patient's doing, and then slowly starting to move into shorter strokes, and then finding some spots that are a little bit tighter, like right over here. And then I'm going to switch into a petrissage technique, which I'll show next. So now I'm going to be showing a petrissage technique. This technique is characterized by using shorter strokes and with deeper pressure. So with Ryan, what I'm doing here is I'm kind of going along the spine, that same area that we did with the effleurage. And with that effleurage technique, we found that the area in between the shoulder blades right here and at the top of the neck was very tight. So I'm going to shorten up that movement. So I stop here, gently slowing down and moving back. And the thing I like to do with this technique here, you can see, I'm using my fingers to help guide my elbow. So the pressure is coming more from my elbow. And the fingers I'm just using for guidance. The fingers are feeling for that spinous process, which is this bumpy part right over here on the back. You don't want to go over that with pressure because it could be very painful. And I'm looking for the soft tissue, the muscle in between that and the shoulder blade. So I'm going back and forth over here until I feel a spot that's really tight. When I feel that, I'll slow down, apply a little bit of pressure. We're doing okay, Ryan? And I'd hold here for as long as I feel like I need to. For the purpose of this video, I'm going to keep moving. And I go along the spine until I find another spot that feels tight. Once we're done with this technique, we'll speed it up a little bit and slowly start to use less pressure, and then work our way back out for our other massage techniques. So that's how you'll use a petrissage technique on an area that's a little bit smaller, somewhere in between the shoulder blades.